He is the founder and CEO of Rubix LX. They're using innovation at greater scale to change how health outcomes are realized through patient and product service innovation. The one additional thing that I wanted to mention to everybody as well before we get started in the interview today is that you can go to my website and download a free course on implementing OKRs. And with that, I will welcome our guest, Reginald Swift.
All right. Thank you for having me, Don. I certainly appreciate it today. And thank you, everybody, for listening in.
Yeah, thanks so much. Yeah, thanks for being here. It's what everybody won't know, right? So we're pre-recording this episode. It's early in the morning for me. It's also early in the morning for Reginald. So yeah, great. Can you tell the listeners just a little bit about yourself?
No, of course, of course. So, yeah, I am the founder CEO of Rubix Life Sciences. I've been in the greater Boston area for about 13, 14 years now. So I feel like I'm almost a native. So, originally from Miami, Florida, but here to really help kind of shape how innovation is. I have an engineering background, so a lot of that tinkering and knowledge is just kind of innate, and just want to be able to kind of look at how innovation can really be change and be impactful for change for patients like myself and others who are in underserved communities. And I've been in the biotech area for about 12, 13 years as well, and want to be able to kind of help support and scale by being an impactful leader to ensure that medicines can work for people, for all types of people, right? And I'm definitely looking forward to seeing where the next, 10, 20 years will go down the road. As we as Rubix becomes a integrative partner in the industry today.
Yeah, very good. And so the company that you started with Rubix LS, as I dug through your career and things like that, I want to kind of get to Rubix in a minute, but still just stay focused on you for a second. So as I dug through your career, one of the things that I saw was, somebody that, more or less started in quality, went to regulatory, and then kind of started on this journey of like, because I see advisor and other things in your career history. And it's always interesting to me how people land on the spot that they're on, right? So
Right.
how did you go from where you were to now all of a sudden Rubix LS? Yeah.
Well, I'm glad that you asked that. It's more of an untraditional path, of course. And for me, I've always been, as I was saying earlier, I've always been a tinkerer at heart, right? An engineer is an engineer, right, or kind of a thinker. So even though I was in quality, and as I was thinking through, what, as people are, within these types of roles, within quality and regulatory and everything else, I thought about efficiency, right? Part of my role before, originally was thinking about how to ensure, validation of products and processes. It ensures efficiency of throughput, right? And then I started thinking through, well, how I can apply this to my everyday life, right? How can I apply this to specifically everyday, touch points that I have, throughout my life, and how it impacts everyone else, right? So I took quality and kind of really mimicked it in my own life as well. So only because I initially did quality, that doesn't mean I only did quality, right?
Right.
I
Right.
was also, on in other roles where I was also consulting in other companies, and just kind of wanted to be able to be, just that integrated team member to help support a lot of the projects, and being able to leverage what I've learned and be able to still have that eternal learning curve for me, and be able to apply that to real world situations. So with the emergence of what I've been learning and looking at myself, I kind of evolved into, because initially I was in aerospace, and then I kind of transitioned into life sciences. So once I moved up to Boston from Connecticut, I was able to, leverage my background in a regulated industry and go into medical devices and biotech. So it's kind of with that lean operator mode, right? Within quality, what I learned in quality, to be able
Yeah.
to leverage that into how pharma and med device and biotech can also be applied. And because I was so enriched by what was happening in biotech, and it's like a kid in a candy store as an engineer, right? Seeing how things are made, seeing how products are developed. It was something that I also wanted to break out into other areas, where regulatory and quality allowed me to see processes as it comes up, right?
Yeah.
Not just to read about it, not just to say, hey, let's facilitate this through paper, but let me go down to the areas, to the development areas, to the R&D centers, to the manufacturing floor, to all the other areas and testing centers, to see how products are made. So it allowed me to kind of start thinking through how I want to also be able to do things like that, for myself. So, kind of being ambidextrous, I also wanted to consult with other organizations at the same time to do the same thing, because I want to be able to pick things up pretty quickly and really help, kind of just accelerate timelines for product development, because I realize that in an impactful industry like healthcare, you want to make sure that products are one, operating correctly and efficiently, and making sure that the patient is safe at the end of
Yeah.
the day. So it's kind of with that thought process that I wanted to also think through, well, how do I help other people as well? So once I started really learning about biotech and med device and pharma, and as I was doing consulting roles at the same time, I also started thinking through, how can I also take that whole process of what I've learned and kind of built it into my own internal system. And that's kind of the originated story of Rubix, right? Of how that was born. So definitely, it took a lot of navigating, up and down paths to get to this point. But I'm glad that I'm here.
Yeah, it's interest. It's always interesting to me to hear people describe their path, because I've said this on other episodes as well, that I feel a bit as if there's some of you and like whatever happens to you, like
Hmm.
that guides your career, but it's almost like your path winds up choosing you no matter what it is. So I mean, it's one of those things where you go, okay, so quality and regulatory, regulated industry, both with healthcare and aircraft. I mean, it to me, um, yeah, it's interesting always to hear how people wind up on the path that they're on
Hmm.
overall. So
That's
as we
right.
as we start to dig a little bit more into Rubix LS, I just want to mention to our listeners. So this website for Rubix LS is worth going to have a look, because for a company that's early to mid stage still, in its life cycle. This website is really neat. And I said it to Reginald as we got started that, whenever I went there, I was really encouraged by what I saw, because a lot of times, we have, sort of flat one pagers in life sciences, and that's kind of it. That's the, sort of the website that we have. So you guys did a really good job over there.
Oh man, thank you so much. Thank you. I'll definitely pass that on to my team.
Yeah, perfect. All right. So Rubix LS. So tell me a little bit more about what problems Rubix LS is looking to solve in life sciences.
No, of course. And with the emergence of what we saw with digital health over the last few years, maybe even maybe 4 or 5 years now, and what the pandemic has taught us about health equity, we want to be able to see the convergence of digital health and targeting health equity at the same time. So the innate nature of what we do is a contract research organization, right? And of course we evolved from what we were before as a consulting, engine or a consulting company to do like product development and everything else. But now we kind of really wanted to say, let's become mission driven. And with what we saw, and of course we've created our own products as well. So we saw kind of the disparity divide around when we've created products ourselves, how is it not being into the patient community that actually needs it, right?
Mhm.
So we realized that there was a broken system that was involved that we needed to try to solve for ourselves as well. So with that said, we kind of took that mission on because that was that drive for us to, and personally, when my father passed away, it was kind of a wake up call for me to want to kind of move into this direction, because the same thing happened to him where, there was clinical trials, but he was never even notified of any of that circumstances. So, these shouldn't be irregular stories or occurrences that should ever be happening, right? And we should be able to allow anybody far and wide in any parts of the U.S. to be able to have access to clinical trials and clinical research as another alternative method for therapies that are unaware of, in the market, right, that are not really out there in the market. So we certainly want to make sure that patients who are in underserved communities and in poor areas and low resource areas, I'd like to say, are able to gain that access. So what we have kind of evolved into is a specialty population contract research organization, where our core focus is to make sure that we target those underserved communities, those patient areas, and we're using tools like digital health to be able to ensure that we can monitor and engage with these types of patients from a distance, right? Because essentially, we want to make sure that we can create logistic frameworks where we're supporting wherever they are, wherever the patient is, and we want to be able to exercise to its maximum intent. And then we're taking that data and translating it into specific precision medicine outcomes for these types of patients. So it's we really focus more on like phase one and phase two at the moment, but we certainly want to be able to grow up and scale, right, and go into phase three, and then really evolve ourselves into a precision medicine company at a later point where, from the data that we've gathered, we become wholly centric towards the patient communities that we want to be able to serve.
Yeah, it's interesting that because I hear a lot of common themes that I've heard in other interviews that I've recently done. I just recently did a podcast about geriatric data. So, the gathering of, loads and loads of geriatric data. And, sort of this idea that, look, this population could provide a lot of insights, as can, underserved communities as well.
Hmm.
A lot of really good points that you made with regards to, getting tied into clinical trials and things like that as well, because it's not easy, right? I mean, and you've got to kind of know a little bit of the landscape and how to find things. And if your physician's not keen to that, or you're not, then most likely you're not going to find alternative therapies that, might help you, especially as you're, battling something that could be life threatening.
That's right.
Yeah, and so one of the things that I picked up on your bio was that you highlight that you're using innovation at greater scale to change how health outcomes can be realized through patient, product, and service innovation. Can you just help us understand a little bit more specifically about what you mean?
No, sure. So whenever you think about how, like, for example, we're talking about digital health earlier,
Hmm.
right? And you're thinking about how the industry of digital health is been accelerating pretty quickly, right?
Sure.
Um, Now we know that the adoption rate for digital health is becoming quickly and fastly becoming the norm. Now, now when we think about specifically how it's adaptable in large metropolitans, well, what about the other areas that we tend to forget? Because when you think about innovation and how rapid it moves, the people who get left behind are the people and not really concentric to these cities, right? So we want to take that approach and replicate it in these communities so that they can also experience the Silicon Valley effect, right? Where you may have innovation to the greater degree in Silicon Valley, but we want to be able to replicate it in like cities like Fort Worth, or in maybe other areas that you probably haven't heard of, right? Like Lawrence here in Massachusetts, and really make sure that people of any background, of any ethnicity, can also have the have the awareness and the foresight to be also firsthand touches around that type of innovation as well, especially when it comes to their health. And what's quickly becoming, the mainstay is that people want to own their own health data, right? People want to be able to understand how their health actually impacts themselves and their family, and what becomes of it from a transparency level, right? On how, why do we get charged this specific rate from insurance versus this, right? So they want to start seeing more of that transparency. So a lot of that cycling happens through ensuring that because we get a lot of that disparity and the health outcomes are worse for people like for black and brown individuals. Well, we want to be able to start looking at how early on, what if the data that we can derive can also help us really get more engaged in the whole process, or in the whole clinical research continuum. All right, so that we can then start thinking through, well, it shouldn't cost me $1,500 for this specific therapy when it could cost me 200, or it could cost me a little bit less, right? Especially for working families who probably can't afford 1,500. So we want to be able, and when we think about innovation at its greatest scale, we want to take that approach and replicate it all across other cities that have poor minorities in them. So that's kind of the way that we think about our impact, and we want to continue to think about it that way moving forward.
Yeah, I've said that in an interview as well, that so I grew up next to Gary, Indiana, and this
Hmm.
divide, the divide in terms of, people that have, money and resources versus the people that do not, was not as clear to me, I would say, growing up. And then as you start to see these populations out there and the needs that they have,
Hmm.
you just start to understand sort of, there's a whole opportunity here that's missing a lot of people. So it sounds to me like, Rubix is really focusing in on a lot of really critical things as well.
Yeah.
So the one question I have to dig just a little bit deeper on that same sort of thought is, how do you get to these individuals, and then also how do you tie kind of the providers that are looking to connect with them?
Right, right. So, what a lot of people may be already cognizant of is that there's a lot of independent physician offices that are in these communities. Right, there's clinics and community centers that we have to kind of lean on to make sure that they're serving the communities that they're trying to serve. So, essentially, what we did first is that we put boots on the ground to ensure that we kind of go into these community centers or clinics to do education, right? Education modules, and be able to kind of work with their CEOs and leaders to ensure that we can install programs for them to kind of get involved and really help drive more incentivization for these community and clinic centers, so that they can also be a part of the trial processes as well. Because when you think about reimbursement, you think about costing, they can shave their costs by being able to be a center for that type of research for the community members. So we certainly want to think of it as a go forward program where these types of groups are benefited at a greater degree than having a whole lot of other people who aren't really necessarily in the process would take advantage of. So we certainly want to go direct to these types of groups and really cut out a lot of the wasteful elements that shouldn't be there in the first place, right? And then what we do is try to create digital hubs where we can already disseminate information down to these clinical centers and these groups, in which as they interconnect to our network and our hubs, we exchange information to say, what, we have these types of clinical trials that are ongoing in from a virtual format, and if they do have patients that are interested, here's kind of how we'll transmit information to them, and we kind of get them involved in that aspect. We've done projects with the VA. We've done projects with international groups like the WHO and the UN, in countries like India and parts of Africa for infectious disease. So we certainly want to continue along doing that for these types of groups until this becomes just status quo, where we're always thinking about everyone at the same time, right? Where it doesn't matter where we are when we think about launching a new clinical trial, everybody's involved in the process. Where you don't have groups like me saying, "Hey, think about everyone else too. Think about these kinds of people too." So we just want that to kind of be the main say, where it doesn't have to be an afterthought. It doesn't have to be a second or third initiative to have for an internal program. It should just be kind of just they can just like one and the same, and then we'll evolve ourselves into something else, right? To make sure that we're still greatly impacting mankind, from a a health perspective too. So that's kind of the way we think about it.
Yeah, I have sort of a strange philosophical question to ask you based on kind of that last answer, right? So do you think, I mean, I personally, you know, um, I have biases of my own, right? That I constantly am having to sort of check myself, just to make sure that those biases that, aren't sort of shaping the way that, that I maybe don't want to go in a particular direction. And that's what I heard in your last answer was, that look, I mean, realistically, we should be thinking about all populations at all times. But I mean, at the same time, do you think that there will be a point in time where, um, people just, naturally encapsulate, all populations, everywhere? Or do you think these biases just continue?
Well, at least in the interim, we know that the biases do continue, right? And sometimes it is not the fault of our own. It's not the fault of the scientists. It's because the scientists are trained as traditional scientists. They're not going to focus on population density and differentiation. That's not what they were focused on. That's unless you become a public health advocate or a public health master, then that's what you do focus on.
Right.
So it has to be an intertwine of business objectives, from industry to intertwine to social, justice, to social, quality, right? So we can really converge on these ideologies so that as a business imperative, it becomes a ESG framework, right? It becomes anything that they think about from environmental, social justice, or anything outside of their focus, that continuum. That becomes just kind of what business as usual is, right? And for so long, you have these long-standing organizations for so long that people have been doing this work for social, health equity for years, right? Before even I got into it. And yeah, business has kind of still been dragging their feet on it, right?
Yeah.
So of course there's been these types of biases to say, hey, well, it becomes much more expensive to get into communities like this, to really try to help develop products like this. But then when you think about precision medicine, well, you can't forget about those populations because you need that data to go into precision medicine.
Yeah.
So you got to just make sure that as a business imperative, you look at the whole centricity of patients, right, on their journey. And I'm hopeful that we're going to get to a point where it becomes just one and the same. Where you're thinking about launching a company, you're thinking about everybody. You're just not thinking about how some places have better access than others, right? You're thinking about how to help them get access. You're thinking about how to ensure that when you're running trials, that these types of groups are equipped with the same type of technologies that anybody else would be able to afford, right? So I think over time we'll come to that realization and be able to launch these types of initiatives as the status quo of the program.
Right.
But for now, it's more like specialty at the moment.
Yeah, I mean, it was one of the things I said a moment ago about, just growing up kind of oblivious to this idea that there's this true economic separation, but there's also like a separation of a lot of different things in life that, because of those additive sort of effects, you sort of lead you to a place that, that people only have certain opportunities and they don't have other opportunities, the same
Right.
opportunities, say as others. And I mean, I think COVID, kind of, highlighted one of them, which was, whenever all the kids were sent home with, laptops to go do Zoom calls, some of the kids didn't even have internet. Well,
Right.
I mean, who would think that, you have kids in the United States still today that don't have internet at home? I mean, it just kind of seems like almost like a staple, like electricity and water
Hmm.
anymore. These are the things that you've got to have. But at the same time, there are populations here that still don't have it. And, I
Right.
think on the opposite side of that spectrum of bias is, you know, you can you can exclude populations by just not thinking broader about what they don't have access to, right? I mean,
Mhm.
and information about, clinical trials or how to get involved could be one of those things. So you could naturally exclude somebody based on the fact that, they just don't have the information. So,
That's right.
yeah.
That's right.
Yeah, and so I mean, on the opposite side, when companies come to you, what sort of problems are they looking to solve? So we dealt with kind of the patient side of things, and how do they get involved? On the opposite side, how do companies get involved with you?
Well, you know what? It's funny that you mention that because it starts from a cascade of ask, right? Initially, they're always asking about, well, what type of data do you guys have around these population sets, right? Around this disease setting, and we're able to share that information, of course, and then say, hey, this is kind of what we've seen historically, right?
Mm,
And a lot of that, if they have the actual data themselves of what they actually have seen historically, because I honestly will say EHR records, it's great, right? It tracks, the patient and understanding kind of their, interface points, but it doesn't tell, the whole story. And there's other types of records that you can be able to aggregate to understand from a greater scale, what socially is impacting these types of groups as well. So, we take a whole lot of other data points, and we have public-private, partnerships with groups where we are able to access information, and we kind of create a storyline, right, for each patient. And between progenitor, indicators for specific diseases, we can understand and really signify, hey, these types of groups will in this type of area, and down to drive it down to the zip code to say, basically, from what we've seen from environmental factors, now these groups are going to be highly prevalent in these types of cancers versus these types of cancer because of the longstanding nature of some of the architecture or the environmental factors that haven't been traced or tracked yet, right? So,
mm,
we're looking at these types of longitudinal types of plans and these data points so that we can start driving much more intelligent conversations around product development and clinical development so that it helps these organizations to say, oh, you know what, we make sure we need to kind of create a new separate arm for these types of patients. And then that's kind of where we come in, not just from the data itself anymore. Now we come in and say, hey, you know what? We actually have a network over here where we can engage with these types of special populations for culturally competent trials, right? Clinical trials, so that we can start driving, patient adherence. We can start, driving, engagement, and really help, really solidify, you know, 12 week, 16 week, 2 years of data points, right? Where, we can monitor and engage with them from any phase 1 or phase 2 studies.
excellent. So, Reginald, there's three questions that I like to ask every guest. What inspires you?
You know, honestly, it happens to be when I still see, women and men, people of color who still have a higher prevalence of illnesses that could be preventable, right? And I still think that what drives me every day is just kind of thinking that my dad is in my head, and saying, what, I still am here for a reason, right? And I'm still doing what I'm doing for a reason, and it's calling me to continue the path, right? And it's to ensure that the right person along my path will come and will help scale Rubix to an enterprise level, right? And we know we're getting there. It's just, of course, with any small business, emerging company, it always takes time, right? Always takes longer than you hope for. But we do know that we're still on the path to make sure that we're impactful.
Excellent. Thank you for that. What concerns you?
Well, I think we could be here for another 2 hours. What concerns me, but I think with the changing nature of life sciences, right, and how innovation is being adaptable in many different areas, I just think that we still run to the shiny ball, the shiny object, And I think that we run to it so fast that we still keep forgetting the blinders. We're still blinded by other factors that we still, have yet to realize, to keep looking and seeing. And what concerns me is that we're still going to kind of still be in that perpetual motion that people are from the sides are yelling health equity, health equity, health equity, but yet the people that need to help other people, like the VCs to help these startup companies thrive, they're still focused on blinders, and they're not necessarily impactful ventures. And there are impact ventures that are out there that are willing to help, but we talk about the major ones. They may have specific initiatives to say, hey, we want to be able to help, but it really hasn't translated at all. And I think it's going to, shore up, and then it becomes back to what we used to be, right? And then we're still going to be in a cycle until the next pandemic happens.
Yeah. Yeah. I mean, it's, that I for sure have seen the shiny object, sort of dance as well, that, a lot of people do. And yet you have scientists who have based their lives on certain forms of science as well that, sort of won't give it up either. I mean, they're just like, look, I mean, we need to continue to look at this. It's worthwhile, and we need to understand it better before we put it down. So I'm thankful for, for that as well. And yeah, so thank you for your answer there. And then lastly, what excites you?
It's the future, right? Honestly, the younger generation is becoming so socially aware that it's becoming like a demand that things change, right?
Mm,
And there's hope for the future where, if you're having the next generation of entrepreneurs and those who want to actually make an impactful change in healthcare, that becomes a standard for them. They want to see change across the board. It's not, hey, I'm going to take your money blindly and that's it. No, it's, what are you actually going to do for me as well? What are you actually going to be able to do for yourself in this industry as well? So I think there's becoming more of that awareness, and people are becoming awake to those notions that change has to happen, right? From all types of groups that are, aligning to healthcare, right? Whether it's the investors, whether it's the banks, whether it's the VCs, whether it's, healthcare institutions, whether it's, clinic groups, and everybody else. I think people are now becoming much more aware, and it's hopeful to see.
yeah. Yeah. And I mean, I kind of associate it too, just in general. I mean, I think, I mean, it's kind of unfortunate to say this, but at the same time, I feel like it needs to be said. I, as much as COVID was an absolute tragedy, I think it woke up an awful lot of people in terms of awful lot of things.
Yeah.
Um, and that, it's not just about sort of what you're delivering for the company, but also what is the company, coming back and delivering for you as well. And I've had this whole discussion around quiet quitting. This term quiet quitting came out while I was finishing writing a book. And so I wrote a book on overcommitment, and it's available on Amazon if anybody's interested. But the whole premise of the book was, as I saw people move out of the office into this virtual world, you just saw calendars stack up and people just become even more overcommitted and less focused on their life. And so, the whole premise of the book is how to focus more on your life and find that balance.
Yeah.
And I think people are fighting for that same thing in terms of, what they're getting with companies and things like that as well.
Hmm.
Yep.
I agree. I agree. And with the whole term of quiet quitting, I mean, it's relatively new for me. But I guess in some form or fashion, I may have done it at some point, for roles that I wasn't really enthused about. But I just never thought about it as quiet quitting. It's just that, what, I'm about to get up out of here. And I will give you my 2 weeks. I'm in, and just say it. For me, but I know that we're in a new world, right?
Yeah.
Opportunities do slow down, and of course, people are probably looking at the horizon as far as kind of where the next opportunity is. So, satisfaction, it's paramount, right? It's paramount to a good work life balance. If people aren't satisfied in one area, they may be unsatisfied in another.
Right.
And you don't want that to spill over, right, into your health, into your life. So, I think it's a way for people to just kind of, have a defense mechanism so it can protect the other parts of their life, right? When you think about quiet quitting.
Yeah, it's funny though. I mean, if you read the last thing on this item, but the quiet quitting definition is like, if you're not giving your 24/7 commitment to your organization, that's quiet quitting. And I was like, wait a minute though. I mean, if
Right.
I sign up for a 40-hour a week job, the company realistically gets 40 hours, and then if I want to go, I don't know, put up an Etsy store, or I want to do something else, that shouldn't be seen as quitting. I mean, that's me kind of balancing my life.
That's
It's,
right, and people should be allowed to do that.
right.
Absolutely. And for my team, I encourage whatever they want to do. There's no 40. I mean, there's no, and I don't allow for my team to say, hey, dedicate your whole life towards Rubik's. No, I want people to also have. But that's the whole goal of our mission, right? Is to ensure that there is awareness and equity, right? So it shouldn't be where people aren't satisfied to help me when they can't do anything else. They should be able to allow the freedom to maximize their life, right, to their benefit. So, and I think of it that way: is that we are where the people are, and we are what the people do.
Yeah.
So, if people have personal commitments in the mornings, cool. All right, that's just life, right?
Yeah.
That's just what it is. So, um, and we just kind of are flexible in that term. So, we want to be able to continue that.
Yeah, so important. So important to have that balance, but also, I mean, I think it very much touches on a lot of the topics that we've hit on here with regards to Rubik's as well. So, Reginald Swift, I really wanted to thank you for being here on the Life Science Success podcast with me, and thanks for spending time.
All right, man. Thank you so much, Don, man. I certainly looking forward to coming on again sometime
Oh,
soon.
all right, thanks so much.